influenza virus may hit India in the month of August or September, medical experts are recommending people to take an influenza shot to keep themselves protected against other flu and viruses. The idea behind this is to keep the hospital beds, medical equipment reserved for COVID-related illnesses and not for other diseases like malaria, dengue, etc. But are these shots safe? Who all should take these shots? And to answer more on this, we have with us Dr. Pawan Kumar. He is the Senior Consultant, General Pediatrics from Madhukar Rainbow Children's Hospital. Welcome, Doctor. All right, Doctor. So what exactly is this flu shot?
So this flu shot or the flu vaccine is made to prevent the flu infection or the influenza infection. This trend started from year 2009. Then all over the world, there was a pandemic of influenza or the swine flu pandemic. So after that, these vaccines were developed and distributed all over the world to be given for the prevention of such pandemics in the future, because after that pandemic, this influenza illness has become epidemic in part of the world, and it spread every season, either in the monsoon season or the start of the winter season. So to prevent those epidemics or viral illnesses or influenza illnesses, these vaccines are given to susceptible population, to children or the older age people, so that they don't develop respiratory illnesses, because many a times influenza is also a deadly disease.
Right. So since you said this vaccine shot is available for everybody, is there anyone who is eligible and not eligible for the shot?
Ideally, this vaccine, according to CDC guidelines, this vaccine should be given to every children above 6 months of age, every adult who is more than 65 years of age, or the persons who are at risk for the viral illnesses or mortality because of viral illnesses, like the person who is asthmatic, who is having chronic lung disease, who are diabetic, who are having kidney diseases. So those people should get flu shots every year according to the season.
And when it comes to the side effects, are there any side effects of the shot that one should know about?
Normally, this is a milder vaccine. It doesn't cause much of the side effect like any other vaccine. Very rarely it can cause fever, but little bit side effect, like local side effect at the injection site in the form of little bit soreness, some pain, some myalgia on the day when we receive the vaccine, body ache, little bit tiredness is common with the flu shot. Common side effect like GB syndrome or a paralysis of the body can happen, but it's very rare. So it is contraindicated in those patients who have history of GB syndrome post this vaccination. This vaccine was also initially contraindicated because this vaccine is made in egg cell culture. So the persons who are having history of severe allergy to egg were also put in the contraindicated category of the influenza vaccine. But from 2017 onwards, even the egg allergy is not a contraindication for the flu vaccine, but it should, when the person is having history of egg allergy, this vaccine should be given in the medical setup under observation. Other than that, no major side effect. A flu shot which is available in the form of the nasal live vaccine, that's not an injection, it is given intranasally. That can cause little bit flu-like symptom in the form of little bit sore throat, sneezing, little bit of fever, body ache, tiredness for 2-3 days, like a mild influenza illness. Otherwise, this is a totally safe vaccine and doesn't cause much of the side effects.
Absolutely right. So since we are talking about the allergic reactions, there are advices that anyone who is allergic to the components of a particular vaccine should actually avoid taking it. So is it the same for the flu shot that we are talking about?
So normally the flu vaccine component does not cause any allergy, except I told you one major indication, one major contraindication I can say, like the Guillain-Barré syndrome. It's called as GB syndrome. Any vaccine or many vaccine can cause GB syndrome after the vaccine shot. So if a person is having history of GB syndrome in the past, which developed after receiving this vaccine, should not receive this vaccine again. Otherwise, it doesn't cause any severe allergic reaction like anaphylactic reaction or life-threatening reaction because of this vaccine. Normally, it doesn't happen.
So if a common person wants to take this flu shot, where can a person get it? What is the name of the flu shot, and any other details you want to share with us?
So flu shots in India are available in two forms, either trivalent vaccine or a quadrivalent vaccine. Trivalent contain three different virus component which are mainly prevalent during this season, because this vaccine comes every year with some changes, because virus mutates every year, and WHO gives, or scientists give every year a new guideline that these 3 or 4 strains are going to be most prevalent in this season. So try to make these vaccines. So vaccine company manufacture the vaccine every year afresh using the virus component which will match most probably the spreading influenza virus. So trivalent vaccine or the quadrivalent vaccine are available in India by many companies like GSK gives the Flurix Tetra vaccine, Abbott give Influvac vaccine, Sanofi providing flu quadri vaccine. So these three are the major vaccine supplier for this vaccine. This vaccine is available with most of the hospitals or even the pediatric clinics. They are having this vaccine with them, and parents can get their child vaccinated every year till indicated for the prevention of influenza. Adult people more than 65 years of age should get this vaccine, because in these age group, viral influenza is more deadly or more life-threatening.
Right. Any particular group of people who are suffering from any of the health complications who should actually avoid taking the flu shot?
No specific contraindication from the health point of view that somebody feels that if I'm having any cardiac condition or I'm having diabetes or I'm pregnant should not get it. No, it is recommended for the pregnant woman as well. It is recommended for the cardiac patient, patient with the lung diseases, patient with the diabetes or patient with the kidney disease should get this vaccine. It is more helpful for them, because if they are having already one disease and they develop any serious disease because of influenza, it will be deadly for them.
Right. When it comes to the people who wants to take the vaccine, what precautions should one take while getting the jab, like before and after getting the shot?
So no specific precautions required. It's because it's a seasonal flu shot. It's like any other normal vaccine, and it doesn't cause any major side effect. So no specific precautions required. Like somebody says whether I can eat food or not food before vaccine, after vaccine. Yes, you can eat food. You can uh, drink milk, or you can drink anything you want to drink. You can come for the vaccination whenever you're ready, and even after getting vaccine, don't no specific precaution required. Just wait, observe for some symptoms, whether the child or the person who is getting the vaccine is developing fever or any body ache or any severe headache. Then they can take some simple paracetamol tablet for controlling the symptom. Nothing else is required.
Any other vital point that I have missed while talking about the flu shot?
So the vital thing which is prevalent at this time, which is missed, is people are confusing nowadays, or myth is going on, maybe by media or maybe by just by the word of mouth. The people are thinking that this time if we get the influenza shot, it will prevent against the COVID as well. So this is totally a myth. Science says there is no correlation between the COVID vaccine or the influenza vaccine, or if you are getting influenza vaccine, you are prevented against the COVID. No, it is not like that. Influenza is also a respiratory illness. COVID is also a respiratory illness. In this pandemic time, a person can get both the things together. A same person can get COVID as well as influenza at the same time. Then the things become more deadly. When if we give influenza prevention or influenza shot during this time, which is more relevant, because by giving the influenza shot at this time, we can prevent hospitalization because of influenza during this time, and we can spare the beds for the COVID patients. So in this way, this is more relevant and more important to have influenza shots during this season, during the COVID pandemic. At least this is necessary.
So does it reduce down the severity of the COVID infection as well?
No, it should not. If both the infection are together, a person is having both COVID as well as influenza, surely it prevent the influenza and reduce the severity of the respiratory illness. But influenza virus is totally different virus, and it prevention against the influenza virus, a vaccine which prevent against the influenza virus does not prevent against the severity of the COVID infection.
Thank you so much, doctor, for giving us your time. Just to end the discussion with looking at the conditions right now, any suggestions from your end to the common people who are, looking at the video right now on how they can stay safe?
So I would like to say that influenza is again a respiratory illness. It's spread by droplet or from a person to another person through the respiratory route or through the air droplets. So social distancing is a norm at present. To prevent the COVID, you keep a social distancing and mask. Similarly, to prevent influenza also, because it will prevent influenza in this season or 1 or 2 season, it will be helpful uh, in spreading the COVID COVID infection, or it will be helpful keeping the hospital free from influenza illnesses, because during the season is a influenza patients are a big chunk which require hospitalization. If in the season we can prevent the influenza, surely we will be able to treat more and more COVID patients, and in the way we'll be able to help the society in bringing down the COVID mortality.
Thank you so much, doctor.
Thank you, most welcome.